Good afternoon, everyone. Thank you for joining us today. My name is Mike Montez, and I'm the National Sales Manager here at MediGap Advisors. And I'll be your host today as we discuss what we need to know about Medicare's Annual Enrollment Period and how to best take advantage of this short window of time that folks are given each year. So today's presentation will be focused on the topic of open enrollment and what it means to you. And we're going to do our very best to make this material as easy to understand as possible. We're going to keep today's webinar short. However, I do encourage you to pay close attention since the information is very valuable and important. If you stick with me until the end, you'll be completely prepared to take maximum advantage of this important time frame. And more importantly, you'll learn how to save lots of time and eliminate frustrations year after year with our help. The information we'll cover today can potentially end up saving you thousands and even tens of thousands of dollars during your lifetime by helping you make the right choices and decisions about your health care. To minimize distractions, we currently have all the phone lines muted. At the end of the presentation, we'll take some questions if you have any. And you can also use the chat box to type in your questions as you think of them, and we can address those at the end as well. Now, due to Medicare's strict guidelines, this webinar is intended for educational purposes only, so we won't be able to address anyone's plan-specific questions or how one carrier compares to another. However, we will give you some exact instructions on how you can go about addressing and getting those specific types of questions answered if you have any at the end of our session today. Lastly, I want to note that MediGap Advisors is not affiliated or endorsed by CMS, Medicare, or any other federal organization or state agency. So with that said, let's go ahead and get started. We'll go ahead and start with a brief overview. You do have some choices as to how you can have your Medicare benefits covered. Number one, you can choose Original Medicare, and many beneficiaries do purchase a Medigap or Medicare supplement insurance policy to help cover the expenses that are responsible for after Medicare pays their share. And many of the same beneficiaries do also choose to enroll in a Medicare prescription drug plan to help cover the cost of the medication they have. The second option is choosing a Medicare Advantage plan. Now, these plans are offered with or without Medicare prescription drug coverage. And Medicare Advantage is simply another way to receive your Medicare benefits. It combines Part A and Part B, and sometimes Part D, as in David, which is the Medicare prescription drug coverage. They're managed by private insurance companies approved by Medicare, and the plans must cover medically necessary services. However, plans can charge different co-payments, co-insurance, or deductibles for these services as compared to Original Medicare. Every year, you do have the opportunity to review your choices and pick the Medicare health and or drug plan that work best for you. Our certified advisors, of course, can help you determine this and walk you through the entire process from start to finish. Now, the open enrollment period starts on October 15th and ends December 7th. This gives people with Medicare a full 7 weeks to compare and make decisions, and helps ensure that you'll have the essential plan materials and membership cards in hand on January 1st of next year when the new coverage starts. Now, keep in mind that this period of time, often called AEP, Annual Election Period, only applies to making changes to your Medicare Advantage, Part C, or Prescription Drug Plan, Part D. It does not apply to changing your Medicare supplement plan if you have one. Medigap plans can be changed at any time of the year, but you may be subject to medical underwriting, and we'll touch on this again on a later slide. Now, each year, Medicare plans can change what they cost and cover, and they must inform you of these changes each year. The evidence of coverage gives you details about the plan coverage, cost, etc., and the annual notice of change includes changes in coverage, costs, or service area effective in January. Some plans may choose to leave Medicare. Let me ask you, is your plan, your health or drug plan, leaving Medicare? Health and prescription drug plans can decide not to participate in Medicare for the coming year, and if that's the case, your plan will have sent you a letter before the start of open enrollment if it decided to leave Medicare or stops providing coverage in your area. The members whose plans do not renew their contracts have a special enrollment period that runs from October 15th through February 28th of next year. Before making any changes, what you should consider are the following. Your coverage needs, for one. Do you have or are you eligible for other types of health or prescription drug coverage, like from a former or current employer or union? If so, read the materials from your insurer or the plan or call them to find out how the coverage works with or is affected by Medicare. Talk with your benefits administrator, insurer, or your personal advisor here before making any changes to your coverage. Now, if you drop coverage, you may not be able to get it back, so it is very critical. When it comes to costs, how much are your premiums, coinsurance, copays, or deductibles, and other costs? What is the out-of-pocket limit for medical care? Are you aware of what these numbers are for you? The cost may vary and may be different if you don't know or don't follow the coverage rules. How about doctor and hospital choice? Do your doctors and other healthcare providers accept the coverage? Are the doctors you want to see accepting new patients? Do you have to choose your hospital and healthcare providers from the network? Do you need to get referrals? And for prescription drugs, do you need to join a Medicare drug plan? Do you already have creditable prescription drug coverage? Will you pay a penalty if you join a plan later? What will your prescription drug costs under each plan? Are your drugs covered under the plan's formulary? Are there any coverage rules that apply to your prescriptions? Do you qualify for financial assistance from any state, federal, or private program? What about the quality of care? Are you satisfied with your medical care? The quality of care and services given by plans and other healthcare providers can vary, and Medicare has information to help you compare how well plans and providers work to give you the best care possible. Let's not forget convenience. Where are your doctor's offices? What are their hours? Which pharmacies can you use? Can you get your prescriptions by mail? Do the doctors use electronic health records or prescribe electronically? Do you travel? Will the plan cover you in another state or outside the U.S.? As you can see, there are lots of questions you should get answers to. And since our objective here at MediGap Advisors is to make it very easy for you, we can certainly help answer these and any other questions you may have about anything related to Medicare whatsoever. Now, this is important. We just touched on it briefly, but if you have other coverage like employer or union coverage, be sure to check with your plan's benefits administrator before making any changes at all to your coverage. Otherwise, you could lose coverage for you and or your dependents. Now, if you're enrolled in a Medicare Advantage plan and want to drop it and join Original Medicare, you have this option during the open enrollment period. In most cases, plans will require a letter from you stating that you wish to discontinue your plan. However, you should know that there's no guarantee that an insurance company will sell you a MediGap policy because you may have to meet medical underwriting requirements. The exception to this is if you qualify for a guaranteed issue right. For example, if your existing Medicare Advantage plan leaves Medicare. Now, to save you time, our advisors are more than happy to help you determine what you might be eligible for and what might be available for you. If you're currently in a Medicare Advantage plan, you're also able to switch to another MA plan by simply joining a new one. If you do, you'll be automatically disenrolled from your old plan. Now, you can also switch back to Original Medicare by joining a standalone Medicare drug plan. As I stated on the previous slide, if this is your intention, you need to consider or see if you can qualify for a Medigap policy, and of course, we'll help you clarify whether or not this is a viable option for you. Now, the last point I want to make regarding open enrollment is that messages in the media about the health insurance marketplace always increase during this time of the year. Many people with Medicare may become confused and think they need to enroll in a marketplace plan. Now, please know that if you have Medicare, you're covered, and the marketplace will not require you to do anything different with your Medicare coverage. So the bottom line is that your Medicare benefits aren't changing. The marketplace does not affect your Medicare coverage in any way. Medicare is not a part of the marketplace. And the Medicare open enrollment period, which only lasts until December 7th, is the time to review your health and drug plan options. Now, hopefully I gave you some insight on what you can and can't do during the annual election period and how a person with Medicare can maximize their time. It's very valuable information that folks can continue to use every year to understand their choices during open enrollment. Now, as a reminder, the enrollment deadline will be here before you know it, and we urge you not to wait until the last minute. If you're not yet working with one of our friendly Medicare experts, simply call the main line toll-free at 1-800-913-3416, and your call will be routed to a licensed advisor that can assist you. From that point forward, you'll be able to communicate with your personal benefits consultant via email or phone whenever you have any questions at all about Medicare. You can also schedule an appointment directly with your advisor on your advisor's calendar for a day and time that's convenient for you. And because it's our busiest time of the year, a number of those appointment slots have already been taken. So again, call the main line if you don't already have an advisor assigned to you. If you are currently working with us, then reach out to your advisor directly by phone, email, or by adding yourself to their calendar. We'll be happy to address any and all of your questions, guide you in the right direction, and help you determine the best course of action for your situation. And keep in mind that we represent all of the top carriers and plans throughout the country, so we can help you find the best, the one that works best for you and your situation. And each year we'll conduct an annual comprehensive policy review to ensure that you're always kept in the highest value, lowest premium options available. Best of all, we can do everything for you from start to finish at no cost to you. So that concludes today's presentation, folks. We appreciate you hanging out here with us. We'll now open up the line for any questions in case there are any. In the meantime, I'll show a couple of our many excellent testimonials from two very satisfied clients, and we have hundreds of these in our file. Okay, so I don't see any questions on the chat box or anything that's coming through. Once again, we want to thank you all for taking the time out of your schedule to join us today. We hope you got some value out of the presentation and hope everyone has a great evening. Thank you.